So for if you checked the notes, there's like a shit ton of different types. Green stick, complete, incomplete, comminuted, spiral. I want you to focus on 3 features? I don't even know how to say. So, okay, first of all, complete versus incomplete. Okay, pretty simple. Broken all the way through, not broken all the way through. Does that make sense? For instance, in children, because the bones are kind of softer, so-called green stick fracture, you know, like if you try to break the fresh branch of a tree, it's sometimes hard to break it all the way through. It'll come. Hold on. Simple versus compound. Oh yeah. Or same story, closed versus open. Okay. So simple, everything stays inside. It doesn't mean that it's really simple. Okay. Or closed, everything stays within the skin. Compound or open fracture, it sticks out. I haven't seen that video, but I've heard the guy from University of Kentucky. Everybody knows that video, I suppose. It was, I believe, live. March. Yeah, that was pretty hard. You know, that was a typical. I swear I did not watch that video because of ignorance. But from what I've read, yeah, it's open or compound fracture. Compound fracture is obviously always complete, always displaced, and sorry that always requires surgery. There's no other option, right? How can you fix the fracture? I cannot hold myself. I was telling my favorite story about fractures. Even I can record it. So, how you fix the fracture? You align the bones. So displaced, you need to realign the bones, right? And non-displaced, you don't. So basically, green stick fracture in kids is incomplete, simple, non-displaced fracture. What you should be able to do, I give you a description of what's going on the exam, and you tell me, like, which of the characteristics, which of the following descriptions works. Okay, the reduction of a fracture is basically putting a cast, or surgical reduction, inserting a pin, or multiple pins. So, I'm going to pause. Now, in terms of the fracture healing, relatively simple. There are a few steps that I want you to know. So when the fracture is formed, first step, when you snap the bone, remember all those blood vessels? So you've got hematoma. Blood spills out, platelets do their job, form the clot, so you have a hematoma. After hematoma is formed, macrophages come over, start destroying debris, and what's important, fibroblasts, the connective tissue cells, they lay down, first of all, the connective tissue fibers, and then eventually they form so-called cartilaginous callus. So basically it's the layer of cartilage that connects two ends of a bone. Does that make sense? Eventually the cartilage that forms the cartilaginous callus is replaced by the bony callus. So this is the spongy bone that connects two ends. Finally, this bony callus is remodeled into the proper bone. And the question why? Well, when cast is removed and you are told, you know, you can use your arm or your leg, but you got to be careful for maybe a couple of weeks, you know, what happens, you're using your arm and your leg in the same way you did before. So that bone experiences the same mechanical stress, well, I don't have it here, but same mechanical stress as it experienced before. Which means it's going to remodel and it's going to form itself the same way it formed before. There's nothing new to that bone. I mean, this is the mechanical stress that drives the proper healing. Okay? We're good? So this is what you need to know for fractures. Okay. Other bone conditions. Yeah, we'll do Paget's. So, I don't like Paget's disease. Not, you know, like, not in the sense that I don't want it to happen to me, obviously, but I don't like diseases for which the only thing I can say, we don't know. We really don't. We don't know why it happens. Okay? What we know is that it's basically abnormal bone accumulation. And it's mostly spongy bone. The main sites, if my memory serves me well, head and hips for some reason. And if the head, the accumulation of sponge bone in the head results in just deformities in the hip, it may actually affect the functionality of the joint and, you know, mechanical resilience of the joint and stuff like that. Okay, I mean, causes really, and I'm a trained virologist. I've been doing virology for many years, and it really pisses me off when people don't know what causes it. Just some kind of a virus. Come on, people, it can be some kind of a virus. Now, next condition. Rickets. Is that 1T? Well, let's start with 1T, or osteomalacia. Okay. So rickets is, in kids, osteomalacia is adults. That's it. Low calcium. Next time you're buying food, I mean, just when you buy food, just out of curiosity, read nutritional labels. Almost all food in the United States, the one that can be, is enriched in calcium to avoid this problem. Okay? If you eat normal, regular diet, it is really hard to develop either. Of course, there are conditions when people develop osteomalacia due to we can call it osteoporosis for the same kind of, they're kind of similar, but we'll talk about what osteoporosis, why we put osteoporosis in a separate category. Can be dysfunction of parathyroid gland, yes, but mostly it's the dietary calcium deficiency, rickets and osteomalacia, which results in the bone deformities, obviously, because if a child during the growth does not receive enough calcium, right, then the bones will experience, mechanical stress, but they won't be able to properly respond to that mechanical stress and basically have bowed bones. Now finally, let's talk about osteoporosis. Affects mostly women post-menopause. So menopause results in the lower estrogen levels. okay, which results in the lower calcium deposition. That makes sense? This explains, okay, first of all, do old men, develop osteoporosis? Absolutely. But they are at the lower risk because in men there is no precipitous drop in the levels of testosterone. Does that make sense? Now, risk factors. Obviously, female, okay, age. Each of this is independent risk factor. Small body. Smaller women are at the higher risk than bigger. Alcohol. People throw smoking at everything, so probably yes, but like, you're probably going to die of lung cancer first. I know it sounds terrible. Soft drinks, I'll explain why. Sedentary lifestyle. Everybody understands what sedentary lifestyle is. You're not moving enough. I don't remember if I have this table in the notes, in the lecture notes, but I found a really interesting manuscript that compared the frequency. One of the classic fractures in elderly is the fracture of the femoral neck, right here, okay? It experiences pretty significant forces, and older people often fracture it, right? Now, there was a manuscript showing the frequency of fractures in femoral neck fractures in people in the different age groups in Europe versus the United States. And the participants were broken down into males and females, and you could very clearly see, first of all, females much higher, like folds higher. Yeah, I don't remember exactly, but like 3-4 folds higher. But then you start comparing corresponding groups between Europe and the United States, and the frequency of fractures in the US population is substantially higher. And I believe that there are two factors that would contribute. First of all, this. Soft drinks, they are very acidic. When you ingest acid, it has to be buffered. And in the sudden acid ingestion, actually the buffer will be taking, well, it's going to be not calcium, but phosphate, but calcium will leave the bones too. Does that make sense? So acid that you consume indirectly dissolves your bones. Second thing, we don't move enough. When we moved to Louisiana and I saw drive-through alcohol stores, I thought, that's it, that's heaven. We're here. Like, you really don't have to move your ass anymore. In an ironic way, of course, but it's awful. We drive everywhere, we don't walk around, we don't move a lot. In Europe, it's very different. There's a culture of, walking and a lot of stuff within the reach. People move more, that's all, okay? Now, what are the prevention strategies for osteoporosis? Well, let's talk about a little bit about treatment and prevention. Treatment, the most famous, hormone replacements. Bad idea. Example of a wonderful drug marketing, really. If you think about it, it's the drug. Hormone replacement therapy was a drug that was targeted not even on the half of the population. It was targeted on the fraction of a half of the population. And the overall sales were estimated to be $36 billion at the end of 1980s. Different dollars back then. So it was enormous profit. However, they increase cancer risk, especially breast and ovarian cancer, so they're not super popular. Estrogen receptor agonists. Okay, I was, I'm going to broadly say osteoclast inhibitors. I don't remember from top of my head, but there's one that directly stimulates osteoclasts into apoptosis and one that prevents them from actually becoming osteoclasts. But the best strategy to at least reduce the risk exercise. Now, in this case, resistance training. Okay, like walking doesn't cut it, or running. No, it's got to be resistance training. It's got to be lifting heavy objects from the floor. Okay, something that will put enough stress on the bones now. Because basically, and that is true for all people, not only females, basically what we do, we create a savings account. Does that make sense? To spend later. You following me here? You deposit, like, for instance, if I lift heavy objects now, I deposit bone at the higher rate, so when I get older and I cannot do that, okay, I have some bone to waste. Good? Any questions? No? Okay. I suggest we'll wrap it up. We did bone physiology.